Hello, I'm Helen Thorn, comedian and podcaster, and welcome to Weight Loss 360 with Boots Online Doctor. We're here to help you make those little changes that can have a big difference. And this week we're talking about the medical benefits of weight loss. As always, I'm joined by Dr. Sam Willapilli, lifestyle medicine GP, empowerment coach and author. Welcome, Sam.
Hi, Helen. Thank you.
Lovely to have you back, and very thrilled we've got a special guest in the studio today. We're joined by the wonderful Dr Anju Verma, who is a GP, and you have been a GP for over 20 years and is the clinical lead for weight loss at Boots Online Doctor. Hello, Anju. Welcome in.
Oh, thank you for having me. I'm delighted. Thank you, Helen. Thank you, Sam.
We're going to talk about the medical benefits of weight loss. Now, I wanted to ask you, Anju, in particular, about why you're so motivated by this. What have you seen in your practice?
Sure. So one of the things that really stands out to me is seeing patients over all these years struggling and suffering with ill effects of obesity, the heart attacks, the strokes, the diabetes and cancers. So I feel that obesity is present in so many of those situations that I have a responsibility to reach out to as many people as I can to help them understand what's going on, help with some of the education to really reduce these risks and help them as we can.
That's brilliant. And I think, we're going to learn so much in this episode about it, because I think sometimes the motivation for weight loss is not vanity, but, you want to look and feel good. But the deeper long-term health effects is so vital. And I think, to have that in your mindset as well is really important. So as we do every week, let's start with you, Anju, and find out what we're going to be sort of covering, because it's a big topic really about these positive impacts of weight loss.
Sure. So we want to cover today why people might be struggling to lose weight, what's going on in the body, move on to what benefits, medical benefits there are from losing weight, and just to say that we don't have to lose an awful lot to get those benefits, and we'll take it from there.
I'm sure that's going to be very comforting for people, because I think it can feel like a big mountain to climb. And I think, any step forward is going to be of great benefit. Now, we're going to deep dive into the medical benefits of weight loss. And I think it has been sort of overlooked as well. We think about, how we look and things like that. So I think there's a lot of misinformation about weight loss, and sometimes it can feel overwhelming, all the information that's out there. But why do you think people struggle so much with obesity and weight loss?
So I think over the past number of decades, the way we eat has really changed, and the availability of food has really changed. And I think we're all aware that when you go into a supermarket these days, we are bombarded with sort of shiny, colourful packaging and a lot of food that is pre-packaged, processed, already created very conveniently for us. And unfortunately, a lot of these foods are highly processed and can be full of other things, which makes absorbing the nutrients from those foods more difficult, because our bodies don't really know what to do with the additives and these new ingredients that have been formulated to perhaps preserve our foods, to give it a certain texture, a certain flavour. So there is something in that, and there's definitely because of that shift, and it's a big shift that we've started going for more convenience food, less of a whole food diet. Our bodies know what to do with whole foods. Our bodies know how to digest, fresh vegetables, say, or proteins, for example, fresh things. But when they're sort of processed, they become a little bit harder for us. And we also notice that those foods are quite calorie dense, so they've got a lot of energy in them, and perhaps not as nutritious as perhaps we'd like. So we have this lot of energy being taken in, but not so much of that nourishing, nutrient high food that our bodies really are used to. So and that means that in turn our weight can creep up, and we can end up in the situation where we have that weight to lose.
Absolutely. And, just trying to put that into context, if we look back to 2001, 1 in 5 people were classed as living with obesity, whereas now it's 1 in 3. So definitely, as Dr. Sam has said about the food and nutritional values or not, that's definitely having an impact on people getting bigger, accidentally taking in more energy than they need. We've also got more sedentary jobs to an extent, with lots of online shopping. So none of that walking to the grocery store, holding the heavy bags. So we're sort of leading towards excess in without knowing and getting larger.
Yeah, so it's sort of like incidental exercise has sort of gone away, but now there's incidental eating. So we just, everywhere we go, we can buy food. You go to clothing stores now, and there'll be a cafe. Everywhere you go, you can consume so quickly where you wouldn't have before. Totally. And
the availability,
and food just gets delivered to your door within 20 minutes. You don't have to walk anywhere. So it's a huge lifestyle, and we're seeing that. So it's almost like obesity has nearly doubled in that time, which is alarming, isn't it?
There's also been quite an explosion of sugary foods being very readily available. Sugary drinks as well, even the kind of sugar-free or diet drinks, which unfortunately we know now that the sweeteners that we use to get that same sweet hit, even though a drink, for example, might be sugar-free, still has an impact on our insulin system and our insulin, in turn, our insulin sensitivity and our insulin resistance, which we know can lead on to diabetes. So we really... we're kind of up against it. We've got a lot of factors, and there's a lot of confusion out there because, of course, a diet drink sounds like it should be pretty good on a weight loss journey. Yeah. But unfortunately, they're not brilliant. So a lot of confusing marketing out there too.
Now, Dr. Anju, I'm sure all the listeners want to know, why should they lose weight? Why should they bother? It feels like a big challenge and a big, lifestyle change. But why should you give it a go?
Okay, so it's all about improving health for the longer term. And the long way of saying it would be to improve your cardiovascular, renal, metabolic health. But that is a lot to say.
That's hard to remember. I can't even say that. Yes.
That's a lot. So because all those conditions often have obesity present, it is much easier then to refer to it as weight loss. But it is for those longer term benefits. And just thinking about it, that, there are lots of studies now that have shown a small amount of weight loss in the region of 10% can have such enormous benefits. So the results from the recent NHS Digital Weight Management Programme were published, and that showed that patients who were able to lose at least 10% of their body weight were able to go into what's called diabetes remission. And this means that their blood parameters for diabetes had normalised, and these patients did not need medication any longer. So that's a huge win. And it's really important to remember also that this programme is based all on coaching and advice about nutrition and physical activity. So I think that's really impressive results. So having a 10% reduction in body weight can be so beneficial. It can halve the number of obesity-related cancer deaths. It can reduce by a third the deaths that patients with diabetes are seeing. There are so many benefits of losing that sort of 10% or a bit more weight loss. So reducing fatty liver, reducing heart disease, strokes. Let's think about blood pressure. So most people will know that there are two figures for blood pressure. Two numbers are an upper number and a lower number. And so reducing that weight can reduce both those numbers by 10 in the medical measurements. And that can be as powerful as some medicines that patients are on just for blood pressure. People's mood is lifted. I'm thinking about the joints, the ability to have less pain, reduce osteoarthritis. If you think about how much load the knees are carrying in someone who's living with obesity. And things that people don't talk about. So there's a type of urinary leakage known as stress incontinence that can really, really improve with that 10% weight loss.
Yeah, and we're just talking about quality of life.
Yeah.
You're just giving yourself, so many more opportunities for enjoyment and exercise and it's really worth considering.
It can also improve chances of fertility, which we know can be reduced quite dramatically with obesity. improve acid reflux disease. And, even just thinking about that could be another area where someone can stop taking a different medication if they're on it for their acid reflux. So all of this is not about getting someone to a particular size. We're not all the same, clearly, but it's about what health benefits that person can achieve and what the consequences for longevity, for long-term health are.
And it's that years more of life that you feel healthy, that you feel good, you feel well, your mood is better, maybe you feel more confident, because we've got to think of those, this is a 360 journey. This is Anju's here who, she's talking all about those really important medical reasons, but we also know there's a huge emotional journey that we're going on. Maybe this really improves our self-confidence, how we show up in our lives, in our relationships, in our work life, in our family, how we set an example for our children, maybe. There are so many reasons why this weight loss journey can be so powerful for you.
And I think that's it. You just walk a little bit taller, and it's and I think that self-confidence is. It can't be measured. You don't stand on a scale for self-confidence.
No, there's no blood test for that.
Exactly. But you just start making better choices for yourself. So, Dr. Anju, I want to know what is the impact of carrying this extra weight on your body? What is it actually doing? We know we're feeling heavier, but what is it doing sort of internally?
So if we think back to what Sam's mentioned about the sort of nutrition or lack of that's going in, so we've got these foods that are calorie dense, not so healthy necessarily. So we accidentally might be taking in more than we need. Mm-hmm. So then we start thinking, what happens in the body? It will use some of that energy. We're sitting here today, we're talking, where our hearts are beating, we're jiggling around a little bit. And so the work of just being alive, some of the energy is used for that. But then if there's excess, it will get stored as a fat under the skin. So this is your subcutaneous adiposity. So adiposity is sort of the medical word referring to fat cells. But what happens is if we still got too much, it starts being stored in other places, and this is where the problem is. Having that fat being stored around organs, and even worse still, in organs, stops them working properly.
Is this visceral fat? Is that the right word?
A visceral fat, yeah. So that's great.
Around your vital bits. Yeah. And that's what we want to reduce.
Absolutely. And even if it's in the organs, that can be so awful. And the example is the way I sort of explain is if we think of just a muscle cell, so I've got a whole cell in front of me, and its job is to say, oh, there's sugar in the bloodstream, I'm going to utilise that, I'm going to take it in and use it to do whatever I need to do. But our body's now stored fat in there, so it's all full up, and so when the sugar needs to go in, it can't, because it's full, there's no space. And so that has to get stored in other places. And having cells full in this way means that the body just does not start processing things properly. So all the insulin problems that we're seeing.
Yeah, so I think, we're really coming down. I mean, this is very sciencey, but coming down to that cellular metabolism that is so vital. If you think our whole body is made of cells, we want our cells to be functioning really well and beautifully for us so that we have fantastic health and we feel good in our bodies. And you just talked about insulin there. So with our intake of maybe high GI, so high sugar, high carb foods, our body's taking in a lot of energy. Every time we consume food or drinks, our pancreas releases insulin, this fantastic hormone that we have to store our sugars and to utilise and store our sugars. But if we're taking in large quantities, and a lot of it's like unwittingly, we don't know that we're doing perhaps not the healthiest thing for our body, that insulin keeps being released, and our cells start to become resistant to that insulin, and we start developing, we're just not sensitive enough.
So you're putting on weight more quickly.
Yeah. So that, and also your metabolic health is suffering, and you're going to become insulin resistant, and that leads to type 2 diabetes in the end, and then all the issues that come along with that. Another thing that we can talk about is this kind of background inflammation in the body that can come about when we are, say our pancreas is working really hard, releasing that insulin, we're taking in perhaps processed foods that have these components that the body's kind of struggling to digest a little bit. There's the inflammatory level in our body kind of increases in the background. So that means that our inflammatory hormones like cortisol are released in kind of this higher background level, which we might not notice on a day-to-day level. However, it might be impacting the pain in our joints, our headaches, our maybe IBS symptoms. This kind of background inflammation has a role in kind of this daily discomfort, but also when we talked about, as Anju talked about, that visceral fat deposition is much more likely when more of that cortisol is floating around the body, and it's a natural response of the body as a almost stress reaction to store fat in that way.
Absolutely. And it's like another step towards ill health. So that inflammation is so crucial and so critical in the developing of things like heart disease.
Yeah.
Developing the diabetes. Inflammation has been so closely linked. We're developing quite a lot of cancers now. So all of that with the link with obesity is what we want to tackle.
But the good news is you can change this.
Absolutely. And that's why we're here.
Yes, exactly.
We want to help you.
But I think sometimes we shy away from these facts. We don't want to know we're living our life the way we want to live it. We're joyfully eating, joyfully living our lives, but we may be subconsciously affecting our long-term health. And I think that's sometimes we do have to face those things. But the good news is that you can still live a very full and happy life.
Absolutely.
But making those healthy choices. We've got a question from the community. I love these questions in the podcast. Now, I think this is a really, really good question. The community person is asking, how much weight do they have to lose to have an impact on their health? They said they've got a family history of heart disease and diabetes, and they're currently 3.5 stone overweight.
Okay, so if I can take that one. So the good news, and which might be surprising for some people, is that that person doesn't need to lose a lot of weight to start getting the health benefits that we've been speaking about. So 10%. If we start off with someone who's, say, 100 kilograms or 15.5 stone, depending which of those numbers our listeners like, losing 10% of that is 10 kilograms or 1.5 stone. And that will be really, really helpful for their health.
So I just wanted to clarify. So 10% is good, right? But are there benefits for losing more and getting down to that healthy weight level or goal?
In essence, yes.
Yeah.
10% is a good starter for most people. It's a good achievable goal. You can work towards it. It will help you make different food choices, give you time to embed better ways of being that that people feel proud of, and then it'll be the catalyst to help them lose more weight, to help more positive things in their life journey.
And remember, it's not overnight. These are little steps that we're taking. Look at it as that long game that you're winning, because you want to, yes, lose the weight, but you really want to sustain it and maintain those benefits that you gain.
So to round off the episode, I'd like to get your sort of takeaway thoughts or advice for the listener. Anju, let's start with you.
I think just reiterating and remembering this is about long-term health benefits by losing weight, the reduction in disease risk for heart disease, diabetes, cancers, those big ones, but all the other benefits, the fatty liver, the joints, improved quality of life, that's what we want.
Yeah, because things like today you'll feel good and in the future you'll feel great as well.
Yeah, absolutely. A takeaway from me would be about looking at what's going in your trolley, or what foods are you eating? Are you eating a lot of convenience products, these processed foods, which can be high in energy and a little bit nutrient poor? So really looking at where you can make changes to bring in more whole foods, more real foods into your diet.
And just to remember that 10% as a goal to start with for weight loss is achievable. Don't let that hold you back.
Brilliant. Well, that's the end of the episode. Thank you both. It has been such an eye-opener, and I think Food for thought. Food for thought. Thank you all for listening. Weight Loss 360 is a Fresh Air production with Boots Online Doctor. The producer is Ollie Seymour. We've got a bonus episode coming your way in a few days' time with guest Dr. Zara Damji, who is the clinical lead GP for women's health at Boots Online Doctor. Dr. Zara will be talking to us all about menopause and its impact on our weight. Next week, we'll be bringing a full-length episode where we make a case for ditching that diet. Thanks for listening. We're here to help you on your 360-degree weight loss journey. So remember to follow Weight Loss 360 with Boots Online Doctor wherever you listen to your podcasts so you never miss an episode. Make sure you check out Boots Online Doctor weight loss service for a whole load of other amazing advice and free resources, including a weekly live webinar where our experts can answer your questions. The information shared here is evidence-based to help you achieve and maintain weight loss. However, if you have any health concerns or questions, please consult your GP before making any changes to your diet or lifestyle. Remember, every small change is a big step towards a healthier, happier you.